their cases over. BC has almost doubled their cases over these 6 weeks. Alberta is, I think, up to about 75% in terms of their daily cases over these 6 weeks. We in Ontario, and particularly Niagara, are thus far holding steady. And I think that's because partly we have recognized that the Delta variant was a threat. So it's not like the war has suddenly changed for us the way the CDC is saying. We knew it had changed back in May, and we've fortunately been making decisions, I think, until now that have hopefully set us up relatively well for what's going to come forward. Just going to show you the next graph where I try to bring these other bars here, which are kind of off the charts, into focus. And if you do that, you can kind of see how crazy and squished up this axis is, which is why I showed it the other way. But as you can see, there's some countries that have had really huge increases over those past 6 weeks. And this is all driven by the Delta variant. I want to just focus in a little bit more on BC and Alberta and compare them to us here in Ontario. I think, it's pretty well, I think, known what Alberta has been doing, where they've basically acted as if the pandemic is over and dropped all the precautions. BC has, I think, done something pretty similar. In both provinces, masking is no longer something it's done. Alberta's now gone even a step farther, where they're not even going to ask cases to isolate or do contact tracing again. And this is what things are looking like in those provinces with the decisions that they've made over the last few weeks. So this is BC, and you can see very clearly BC is starting to trend up again in their cases. And that's, I think, a direct reflection of the decisions they made in the early part of July to basically say that we're dropping all COVID precautions. This is Alberta here. You can see Alberta has not done as well as BC in controlling the pandemic. And likewise, start of July, they dropped all COVID precautions, and you can see that increase in cases up. In comparison, this is us here in Ontario, and you can see that blue line is relatively flat. Now, it has gone up a touch over the last few days, but certainly we're not seeing the pace of increase or the speed of increase that BC and Alberta are. And I think that speaks to Ontario's cautious approach thus far is serving us well to make sure we don't let the Delta variant get out of control, at least not yet. Just looking at the reproductive number then in Ontario, just to zoom in on that. And the reproductive number, of course, is how many secondary cases are going to result from your cases right now. If it's above 1, every case is going to lead to more than 1 cases. So of course, cases will go up. If it's below 1, cases are going to go down over time because every case is going to pass infection on to fewer than 1 people. And if it's at 1, you'll be flat. And this is what it's looked like in Ontario. And so you can see over the last little bit, it has dipped above 1. And you probably noticed Friday and over the weekend, we did have some days where the Ontario cases went from being in the 150 to 175 range to being over 200 again. Back down under today, and we'll see what happens here. But I think that's a reflection that the reproductive number is no longer staying well below 1 as it's been for a long time in Ontario. It is now reverting closer to 1. And of course, we are now 3 weeks out from moving into step 3. So that probably indicates that loosening precautions to the level of step 3 has allowed cases to at least flatten out and maybe start to go up a little bit. It's interesting when you split this out, splitting the Alpha variant versus the Delta variant. And interestingly enough, with the Delta variant, we seem to be bumping up and down below 1, but we aren't doing too bad. It looks like this recent jump is actually all due to the Alpha variant, which is a little unusual. And that gives me a little bit of hope that maybe this is more a blip that Ontario's experienced than sustained going to be increased above 1. Because the Alpha variant is easier to control. We've seen we've consistently been able to keep it below 1, whereas we haven't been able to do that with the Delta variant. So I'm hoping this is maybe a small blip that we're going to be able to get back under control in the next little while. This is just comparing case trends, and you can see the Delta variant is pretty much making up all of our cases now. And just to show you how that actually breaks down here in terms of percentages, if you're looking at 100% of our cases, back in this back in March, April, most of our cases were this blue area, which was the Alpha variant. And now increasingly the Alpha variant has shrunk to being maybe 10 to 15% of our cases, and most of our cases are the Delta variant. And so controlling the Delta variant is really the key to making sure our cases don't go up going forwards. Taking a look then at the situation here in Niagara, you can see our cases have come down and we're actually holding pretty flat right now. We're actually averaging about 3 cases per day and really have been doing that for a little over 2 weeks. I think it's around July 19th. Since then, we've basically bumped up and down around the 3 cases per day mark in terms of our average. So we are managing to hold things pretty flat right now. And if you take a look at the reproductive number, that basically bears that out. We have a reproductive number that's kind of bouncing around 1, going above it, a bit below it. Overall, we're kind of averaging out to staying pretty flat with our cases. Interestingly, of those 3 cases per day we're averaging almost 1 case a day, which is a travel-related case. And so if there is a pattern that's emerging, it's that with possibly summer holidays, people seem to be traveling a bit more. And unfortunately, people are coming back with COVID-19 infection as a result. Looking at the breakdown of variants here, sorry, actually, I'm going to skip that. That's an out-of-date slide. But our variants today are showing it's mostly actually been Alpha variant and a small amount of Delta variant. And so that kind of matches a provincial pattern where there's been an odd increase of Alpha variant lately. I expect it's going to be short-lived. So, coming out of the CDC's news last week, there's been a lot of talk about breakthrough infections and about the Delta variant rising, and a lot of concern about, breakthrough infections, vaccine isn't working anymore. And I think that's misunderstood what's happening. I think the CDC has highlighted that vaccines aren't perfect, which is, I think, something I've said quite often, and you are going to get people who are vaccinated who are unfortunately going to get sick. But overwhelmingly, I think the vaccines are working. And, key U.S. officials like Dr. Fauci have been pointing out that if you look at the total percentages, the number of breakthrough infections is actually quite small. And this is actually from that CDC slide deck that was leaked last week, that's been driving a lot of this. And I think here, you have a blue bar for vaccinated people, the green bar for unvaccinated people. And if you're looking at cases, you can see there's an 8-fold reduction in being infected if you're vaccinated versus unvaccinated. So absolutely, breakthrough infections will happen, but it's far less likely than if you're an unvaccinated person. So that vaccine is absolutely working. If you look at hospitalizations and deaths, it's an even starker number, where it's about a 25-fold reduction in risk. And so, as much as people are worried about breakthrough infections, I think a key message here is that vaccines aren't perfect and they've never been perfect. We've never had a vaccine that's perfect. But what the vaccine is doing is it's greatly reducing risk of infection and drastically reducing your risk of being hospitalized or dying. And there absolutely should be no reason people should be worried about their vaccine or how well their vaccine is working. Their vaccine is working very well to be dropping the risk of infection, hospitalization, and death by this much. If you want to take a look at Canadian data, this is data put out by the Public Health Agency of Canada showing that if we're looking at cases of COVID-19, almost 90% of them are in unvaccinated people. Only 4.6% of them here, only 0.5% of them here are in the fully vaccinated group. Likewise, hospitalizations, 85% in unvaccinated people, 0.7% are in fully vaccinated people. So your probability of being someone who's going to be a case of COVID-19 or hospitalized, if you're fully vaccinated, is extremely small. And that, I think, message shouldn't be lost here. Because of these breakthrough cases, and I think because of some policy decisions in Israel where they started offering 3rd doses, there's been a lot of talk about should there be 3rd doses. And Pfizer, of course, who is a pharmaceutical company selling vaccine, has somewhat jumped on this bandwagon, talking about how if they were able to sell us 3rd doses, that would boost our protection against the Delta variant. And I don't doubt that's true, that if you got a 3rd dose of vaccine, you'd probably get a small marginal incremental benefit from it. But I think it's important to note that how well our vaccines are working again. And this is taking a look at the UK, Canada, and Israel. And it's showing here that, in the UK, 79% of, there's a 79% protection from being a confirmed infection, 88% protection from being a symptomatic infection, and 96% from being a hospitalized infection. Very similar numbers here in Canada, 87% protection from being symptomatic, basically 100% protection from being hospitalized or passing away if you're fully vaccinated. And so, there doesn't seem to be a lot of evidence here that you need to get a third dose. You get a third dose, how much is it going to increase is 87%. Are you going to go from 87 to 90, 91%? That's not a lot of benefit, so I'm not sure it's really justified. Israel's a little unusual where they're seeing lower benefit from the vaccine for infection and symptomatic illness, but they're still seeing very good protection against hospitalizations. And perhaps one of the reasons here could be that in the UK and Canada, we spaced out our first and second doses a bit. And we know when you space out injections of vaccine, you sometimes get better efficacy, but that's just an idea. We're not entirely sure. But you can see why Israel with lower effectiveness numbers might be thinking a third dose is needed. I'm not seeing data in Canada to imply that we need a third dose. And I actually think overall, us taking third doses is perhaps not to our benefit. And I'm just going to make a small digression here. We've had a few different variants of infection of COVID-19 have emerged over time. We started out with the original version of the virus that was in Wuhan. When it spread through Europe in late February and early March, particularly through Italy, we actually had a new variant to emerge over that time. It was labeled the D614G variant, and it increased their basic reproductive number from about 2.4 to about 3. So we actually got and this is the version of the virus that actually ended up coming to Canada because the virus spread from Europe to North America. And so when we actually got COVID-19, we didn't have the original version of COVID-19. We already had a variant that was spreading more readily and harder to control, which is perhaps why we have struggled to control COVID-19 as much as, say, some of the Asian countries that seem to be able to control it more easily. We've actually had a more difficult version of the virus to control. You can then see that we had the Alpha variant where that reproductive number went from 3 to 4 to 5, and now the Delta variant where it's between 5 to 8. And so, conceivably, the virus is perhaps 3 times more difficult to control now than where it started, given it's gone through a few successive mutations. And just to show you a graph here of what that's doing to our vaccine efficacy and our threshold to get herd immunity. If we had the Wuhan version of the virus with the reproductive number about 2.4, assume the vaccine efficacy was about 95%, those are the initial vaccines that are developed, a little over 60% of people fully vaccinated, we would be at herd immunity. So we actually in Niagara at 60.4% for fully vaccinated people. We almost actually have enough vaccine that we could be looking at herd immunity where we would almost wipe out the virus here if we were dealing with the original Wuhan version of the virus. Of course, that's not what we got. We got the European Italian strain, a reproductive number of 3. Vaccines, when they initially approved, are showing about 95% effective against that. So our threshold to get to herd immunity was close to about 70%. We are at actually 70.1% in first doses in Niagara. So conceivably, we could have actually brought everybody back for their second dose, and we would actually be able to reach that. But of course, now we have the Alpha variant. Let's take a reproductive number of 4.5, halfway between that 4 and 5. Vaccine seems to be a little less effective, but still pretty good there. It drops to about 92%. But now, because it's a harder to control virus, our threshold for herd immunity goes all the way up to 84.5%. So that's a much more difficult number to get to. Then if we're looking at the Delta variant, a 5 to 8 basic reproductive number. So if we take 7, a little bit in between, vaccine efficacy, it looks like is 87% in Canada. We're looking at we need to get to near 100% for herd immunity. And so we can see with the successive emergence of variants, our vaccines are becoming a little less effective as being much harder for us to get to any kind of level of herd immunity. And why these variants emerge is because if infection is spreading uncontrollably, every time it spreads to a new person, it mutates a bit. If it's spreading through more people, it's going to keep mutating, and you end up with these new variants. This variant emerged in Italy because the virus is out of control in Italy. Alpha variant emerged in the UK because the UK had big, huge waves through the fall, which did not do a good job of controlling. Delta variant emerged in India because India was not controlling the virus well. And so I would argue that rather than Canada taking vaccine to get a third dose here and push this 87% to 90 or 91%, we need to take those doses and actually send them to the parts of the world that aren't vaccinated so they can control COVID-19. And so we stop this cycle of infection spreads uncontrollably in some countries, variants emerge, the variant shows up here, and it makes it harder for us to actually protect our population. We need to actually break the cycle by making sure we vaccinate the rest of the world now. And rather than us increasing our protection from 87% to 90, 91%, which is pretty small, I think we'll get a lot better benefit if we actually protect a lot of people around the world with the vaccine rather than using up those extra third doses here. So a little bit of digression there. Now getting back to the story here, what we're dealing with, hard for us to really ever get to herd immunity, I think, with this kind of number. And we're dealing with a more difficult virus to control. And so, modeling by the Public Health Agency of Canada is showing that right now, with a increasing openness in our society, despite vaccination being in place, if we stay with the level of interaction we have in our society, we can expect to see cases go up. If we reopen further and people start to interact much more, you can obviously see we could end up with a very big wave rather than perhaps a more controlled increase in cases. And so I think the next little while is going to be all about us finding a balance of having more vaccines so we can bend this curve downwards while also not opening up too much to allow us to have this kind of massive rise in cases. We take a look at the Public Health Agency of Canada modeling here. This is looking at if 75% of eligible residents of 12 and over are vaccinated. This would be what happens for hospitalizations. And you can see there's a surge in hospitalizations. These gray bars represent kind of the error margin. And this red dotted line is the max threshold our hospitals could handle. And so you can see we get to a point where our hospitals are potentially overwhelmed if we only have 75% of eligible residents vaccinated. But if we're able to get to 83% of eligible residents vaccinated, that works out to about 75% of our total population. We see an increase in cases and hospitalizations, but not one that comes close to our hospital capacity. And the latest modeling put out by the federal government on Friday showed basically the same pattern, where, our current level of vaccines, we would potentially overwhelm our hospitals. But if we can get our vaccines up a little bit higher, particularly getting it to about 80% in the 18 to 39 age group, that would get us close to that 83% of eligible residents or 75% of the population as a whole. And then we see an increase, but one that doesn't overwhelm our hospitals, and it is manageable for us going forward. I think before we can get to that level of vaccination, instead, what we could do is we could perhaps take on additional restrictions in society. We could have us wearing masks and keeping physical distance. Some of those measures could be a substitute for getting the vaccination numbers up. And I think we're looking at a fall, looking at something like that. This is some modeling done by the US here, and taking this scenario, which is assumed to be Delta variant, with national immunity of 5%, much lower than this here in Canada, when fewer than 1% of our cases are identified as being cases, so we probably are much lower. But the CDC was showing that this purple region here, I'll maybe start with this brown region here, is if nobody's masking, this is the probability that you're going to see cases increase, and you can see that that's near 100% here. And only once you get the vaccination coverage approaching 100% does that brown area start to fall. If unvaccinated people are the only ones who go unmasked, you're in this yellow range here, which kind of overlaps, but we're kind of looking at this range here. And again, you need to get vaccinations to pretty high before that area of the yellow line starts to fall, and you have a chance of maybe controlling infection with only unvaccinated people masking. This purple area then is what happens if everybody masks, vaccinated and unvaccinated. And you can see at around 60%, you start to get into a range where you could have the possibilities of actually seeing the Delta variant controlled with everybody masking and 60% of people vaccinated. Of course, as you get that up, you get to a point where you're almost certainly going to have the virus controlled with that level of vaccination. And so I think that matches, I think, what the Public Health Agency of Canada is showing, that we need to get the vaccination coverage a bit higher. And until we get it higher, we can drop all our precautions, including something like masking. Similar kind of data here. This is from the Robert Koch Institute in Germany. And this is here showing if 75% of the population was vaccinated, you get an increase in cases here. This is if 65% here is vaccinated, and you can see there's a big wave. These are cases per 100,000 per week. So, this is looking at Niagara, far higher than we've ever been, which this here would be looking at probably on the order of 100 to 150 cases a day if we are at this level. Right now, our vaccinations, of course, is somewhere between 65 and 70%. So, we're not high enough. Once you get to 85% of the 12 to 59 group vaccinated, and I think it's 90% of those above 60, you get to this curve here where in a place like Niagara, we probably see 70, 80 cases a day, but you wouldn't see this massive surge that way where we're going to get, hundreds and hundreds of cases a day. So I think we are potentially looking at an increase in cases unless we have measures in place to contain that. And, I think this is a balance we need to strike where the Delta variant is going to be pushing up our cases, and we have all kinds of things in place to keep our cases down: economic, social restrictions, border controls, keeping physical distance, wearing masks, and vaccinations. And hopefully as we get vaccinations up, if we are able to start to then reduce those economic and social restrictions and border controls while keeping physical distancing and mask wearing in place. So just quickly touching on where we are with vaccinations here in Niagara. Eligible residents, I've talked about the federal government modeling says we need to get to 83% of people fully vaccinated. So we're at 79%. We are getting close. All Niagara residents, we need this to be up to 75%. So we're getting close, but there's a little bit more work to do. Obviously, we've slowed down. And the greatest area where there's opportunity to increase vaccination rates is very much in the 12 to 17, the 18 to 29, and then maybe less so in the 30, 39, 40 to 49 age groups. But these are where we even have first doses, not up to that 75% level. So this is going to be a big focus for us going forward in terms of increasing vaccination. And there's a few things that we're working on right now to increase vaccination. I think first doses is the more challenging part. We of course doing walk-ins at all of our vaccine clinics. Niagara Health is doing walk-ins. Lots and lots of pharmacies are doing walk-ins. So on the spur of a moment, anybody can choose to get vaccinated. You don't need to book. You don't need to plan. You can just, whenever you have a moment, go and get vaccinated. We're doing a lot of increased promotion of vaccination, both online and physical signs, even going into public places to promote a nearby clinic and talk to people about it. Primary care providers, some of our public health programs, we're now routinely asking our clients and patients if people have been vaccinated. And if not, engage them in a conversation of why not, and hopefully trying to convince them to go out and get vaccinated, and then actually facilitate them getting into the closest vaccine opportunity for them. We're going to be doing more clinics in smaller communities. You've probably seen we're going to places like Lincoln and Waynfleet and Grimsby and the like more often than we have in past months. And because we're not delivering as large volume of the vaccine and have this flood of people wanting appointments for vaccine, we're now able to run clinics in some of these smaller locations. And we're also going to be doing some pop-up clinics in other community locations in the coming weeks, which will be an extension of that. We've begun doing some pop-up clinics in social housing. So these are quite marginalized people, often don't have transportation, don't necessarily have great connection with the healthcare sector. So bringing vaccines to them is one way we can hopefully get some more first doses done. And then we're recommencing visiting long-term care homes and retirement homes, making sure we finish vaccinating any people who've been newly admitted in the last few weeks and we haven't vaccinated yet. We're also taking the opportunity to make sure all the staff there, everybody else is fully vaccinated as well. So we can make sure we keep those areas as safe as possible before we see an increase in cases. Then of course, with second doses, we're doing all of these same strategies, but another big one is we know the people who've come for their first doses. We have their contact information. And so we're calling all of these people who have not yet got a second dose lined up in the next couple of weeks to make sure they line up. In our public health clinics, we also see there's about 13,000 people who have appointments for their second dose in September and in October. And of course, nobody needs to wait till September and October anymore when we have hundreds of spots every day that we could accommodate them. And so we're going to be calling those people to encourage them to get their vaccine as soon as possible so that we can hopefully get everybody vaccinated in the month of August. And we don't need to be running those clinics in September and October. We can maybe start doing more of these pop-up opportunities and other kinds of opportunities going forward. And so you'll increasingly be seeing some of those kinds of initiatives over the course of this month. And with that, I'll stop there and turn it over for questions.
Perfect, thank you. So to start, we have Alan. Alan, you should be able to unmute now. Alan, I don't know if you're asking a question, but we can't hear you.
Can you hear me?
Yes.
Hello? Okay, excellent. Okay, I wondered about the pop-up clinics, if there's any definitive plans that we could report on when and where, I suppose. And I guess about the urgency of getting them done, especially after we saw Niagara Health unfortunately close their clinic yesterday because of the lack of uptake. It seems to really, especially what you just said, put the onus on getting more people vaccinated ASAP.
Yeah, don't have anything yet to announce on the pop-up clinics. Sorry, I was getting a bit of feedback there. Yeah, nothing yet to announce on the pop-up clinics. As you can imagine, going into a brand new location, finding a space, coordinating the schedule around others who might need that space, it's taking a little bit of time. We hope we'll be able to announce some things in the next few days, but don't have anything definitive yet we can announce.
Excellent, thank you. Yep. Wondered, the province, I think, is expected to announce its back to school plan this week. Wondered if you have any insight into what to expect and what your thoughts are on it. Again, especially in light of the 12 to 17-year-old age range and the need for greater uptake there.
Yeah. And, particularly when talking about schools, I'm also very worried about the under 12s who can't get vaccinated at all. And, I do worry about what's going to happen in elementary schools a little bit. I think, I don't have any inside information on what the province is planning. I imagine, and I certainly hope we're going to see a school plan that's actually pretty similar to what we had last year. The CDC has now recommended that students wear masks in school. And so I absolutely think that remains a good idea, especially when you're going to have lots of unvaccinated people, particularly under the age of 12. I think continuing to use all the space available to have physical distancing, organizing classes by cohorts. So when we unfortunately do have cases of infection in the school, we can actually isolate those who are at greatest risk and be actually able to keep the rest of the school still open and operating. Continuing to, have infection control measures, disinfection. I think all of those same measures that we had in the last year, I think are ones that we really should continue. But maybe there can be some opportunity then for additional extracurricular activities and the like happening. So that's what I'm expecting we'll probably see in terms of schools, and certainly what I'm hoping for and I think would be a good approach.
Thank you. Excellent.
Great, thanks. Our next question, John has already let us know that he doesn't have a question. So next is Paul. You should be able to unmute.
Can you hear me okay?
Yep.
Oh, great. Well, thanks. Dr. Hergy, I think you mentioned that with Delta, we're going to need something like close to 100% vaccination rates to get herd immunity. So are we stuck with this then for the foreseeable future? Is it realistic that we could ever get that many people vaccinated?
I don't think it's realistic that we're going to see that many people vaccinated in the next year or two. It's certainly possible maybe 10 years from now, this becomes something like a measles vaccine and everybody's going to get it. So I don't think we're looking at herd immunity anytime in the coming, years. What I think the plan right now is to get COVID-19 controlled to the point where it's not going to overwhelm our hospital system. It's not going to overwhelm our society. And it can become something like influenza, which is unfortunately around. Unfortunately, it does cause people to die, but it's least controlled. It's not overwhelming our hospitals. and we're actually able to start to return to life. So I do see a future where COVID-19 is around, and it's one of those other viruses like influenza that's around, but hopefully we have protection from the vaccines, so we're not all worried about getting hospitalized and we're limiting the number of people dying from it.
And a follow-up?
Yes, I think the mayor of New York was going to announce today the need for people to show proof of vaccination for workers and customers at places like indoor restaurants and gyms. I know there's been a lot of talk about that, whether to have vaccines or certification in Ontario, but do you think that could be an important step towards getting people who are on the fence or who maybe are anti-vaccine to step up and get vaccinated?
I think it's certainly an option to go down that road. I do think we need to be cautious about rushing towards that. We've never really required vaccinations for most people, in society. There's limited sectors, healthcare sector, where we require certain vaccinations, and I think requiring the COVID vaccine makes a lot of sense there, just given the vulnerable group. But I think we probably should think about the precedent of requiring vaccines for the general public at large. If we're going to require it for COVID-19, influenza, we have 1,300 deaths on an average year in Ontario from influenza. In a bad flu season, it's going to be much higher than that. It leads to lots and lots of hospitalizations. There's always a big winter surge in our hospitalizations. We've never required influenza vaccination. And are we setting a precedent that we would want to start requiring vaccinations for all of these different illnesses? I'm not sure we necessarily want to go down that road. Maybe we do, but I think we need to think through that as a society as a whole before we make that decision. I think the other thing is that before we force people to get vaccinated, we really should exhaust our opportunities to get people voluntarily vaccinated. And our numbers have definitely slowed down, but we haven't yet gone out and done a lot of the things that I think we could possibly get that number up. We're just announcing some pop-up clinics going to come around where we're going to be out in other community locations. By making it easier to get vaccinated, does that make a difference? As people get out of the summer and they're starting to think about school and more of their regular routines, is that going to actually lead to a bunch of people being vaccinated? So I don't think we've hit the end of what we can do voluntarily, and we probably want to see how high we can get voluntarily. And if we're high enough at a level where COVID is going to be controlled, to then decide, do we want to take that extra step of forcing vaccinations or not? The final thing I just want to note is that when we look at who gets vaccinated and who doesn't, there's a pretty predictable pattern that people who are less likely to vaccinate are often of lower income. They're often people of racial minorities. There are people who actually, live perhaps less privileged lives than some of the rest of us. And I do worry that if we start to create a vaccination requirement, in some sense, this is the group who's actually being harmed the most because they're the least likely to be vaccinated. And we're taking marginalized groups and actually marginalizing them even more with a vaccine requirement. And before we go down the road of requiring vaccines, I think we need to do a lot of work to make sure we've reached out to these communities and really help them get their vaccination rates up, so they're not going to be disproportionately affected if we do have these. And that's one of the reasons why we started some of those pop-up clinics in places like social housing, because we know these are groups that have harder access to being vaccinated, and we need to make sure we give them that access now that we have the ability to do some more catered work to them.
Thank you. Okay, next question is Ludwig. You should be able to unmute now.
Yes. Hello, everyone. Good to see you, Dr. Hergy. I'm wondering, as a fully vaccinated person, then, what should those of us who have done that, made that choice, think about when we're around unvaccinated people? I sat down in the backyard with a few friends the other day, and it turned out that none of them were vaccinated. And I was wondering what does that mean for a fully vaccinated individual?
Yeah, so I think the first thing it means is that your risk of getting infected there is much, much lower because you are vaccinated. So you should acknowledge that. That being said, it's not zero, and I think it's prudent to keep taking some precautions. So sounds like you met outside, so that's a great first step. Your risk is going to be much lower for anybody transmitting infection being outside. If the environment supports you keeping physical distance, I would certainly do that. If you're not able to keep physical distance, I think it makes sense to wear a mask in that circumstance when you're around those people. And really everybody else should be wearing masks as well. Those will be the key things that I'd recommend. So, if much as possible, meet with people who are fully vaccinated. If you're around people who aren't fully vaccinated, recognize that while you're protected, there's still that small residual risk, and doing some, sensible things like keeping distance, wearing masks, which we've been doing all along, is one way to make sure that you have that added protection for the chances that vaccine unfortunately does fail you in the circumstance.
And a follow-up?
Yeah, so the reluctance to get vaccinated here in Niagara, it's pretty apparent with what's going on social media. The debate is quite obvious there, with people who are trying to make all kinds of points about the efficacy and safety of the vaccines, etc. What is public health hearing in terms of vaccine suspicion, reluctance? Have your vaccine workers been subjected to any type of hostility or at least suspicion? Like, what has that been for you? Because right now, if you look at the divide between, with the very hardcore anti-vaccination people, they seem to label everyone who's gotten the vaccine as pretty much a separate, entity from themselves. So could you talk a bit about what this has meant for the public health agency and the workers who are working with the vaccine right now?
Yeah, so I do want to draw a distinction that I think of the people who are not vaccinated, there's actually three different groups here. There's the people I think you've just described who are the hardcore against vaccination. They're very active on social media. They're very loud because they have a cause they believe in and they're pushing that cause. There's then a group of people who are unsure about vaccination. So they're not hardcore opposed to it. They can be convinced. Because they're not sure of what their position is, they're not out there speaking very loudly. So we don't actually notice them. And then there's another group who's just kind of complacent. They're actually okay getting vaccinated. They've just not got around to it. Their lives are busy. They've been doing other things. They're busy enjoying their summer. They've just not actually gotten vaccinated. And actually, if you look at those groups, the group who's saying they're fully against vaccination, the poll shows about 8% of the population. The people who are uncertain about vaccination, not too well defined, but it's a reasonable number. And then the people who are just kind of complacent is actually a pretty big percentage. We're talking 15-20% of society is perhaps just complacent. They're willing to get vaccinated, they're just not got around to it. And so where our focus in public health is actually first off on just that complacent group, because we think that if we just make it easy for them to be vaccinated, if we put the opportunity right in front of them, we go to a public place where they're going to be at anyway, and we actually do a pop-up clinic there, they may actually just choose to get vaccinated because now they don't need to put any effort into it. It's just there, might as well get it while they're there. And so I think there's actually a lot of opportunity that we're going to be able to get that vaccine coverage up to 75, maybe even 80% by just getting to those people who are complacent. I think then the second group we're focused on is that hesitant group, the group who's not sure if they want to get vaccinated. And a lot of that is actually, through our outreach work, through social media, through talking to people, we're finding these individuals, we're engaging them in a conversation, and letting them speak to actually one of our public health nurses. And when they have the opportunity to talk to someone who can explain to them details about the vaccine and they can get information from a reliable source, they actually do often get persuaded to go ahead and get vaccinated. Our primary care providers are doing a key part of that as well. When they have a patient in their office, or they're talking to a patient on the phone, they're asking, have you been vaccinated, and exploring why not. And if they have some concerns, they're not sure, they're often able to actually convince them and get them in line to be vaccinated. And so, it's not going to be fast, but I think we're going to be able to plug away and actually turn some of that group. That's just going to leave then that hardcore, about 8% of the population who will never get vaccinated, who I think we, don't really have much hope of convincing, and we just need to sort of try and not pay too much attention to them. Again, I think they're much louder voice than their numbers would actually, proportionally say they should be. And a key thing is that we just need to make sure we keep pushing the truth that counters their lies, so that the hesitant people don't just hear the incorrect information, they're also hearing the correct information. They don't get swayed over to that other side, and we're able to keep setting themselves up to be swayed over to our side once those people are able to talk to a health professional. So, very focused on the complacent people, the hesitant people. And I think if we do that, we can actually get our vaccine rates up much higher.
Great, thank you. Up next, we have Richard. You should be able to unmute.
Hello, everybody. Good to see you all again. So all signs seem to point towards us not being able to get to herd immunity, like you said, for years. Delta cases rising and restrictions staying in effect. So, what is the likelihood we'll see another lockdown again in the fall? And what's the best way people can ensure they're able to, possibly have a Christmas this year?
Yeah, I think we are inevitably going to see cases go up. It's all a question if cases go up only a little bit and are controlled versus cases sort of spiral out of control. I showed you that bit of modeling from the Public Health Agency of Canada that had that gray line where it's kind of softly going up and then the red line where it sharply went up. And it's all about making sure we get on that gray trajectory and we're able to control things going forward. Absolute key thing, I think, is getting more people vaccinated. The more people are vaccinated, even though we won't get to herd immunity, we'll get more and more protection out in society, and that's going to keep things under control. But I think the other thing is that we need to be careful and cautious about reopening. We can't let go of all precautions the way a place like Alberta has done or states like Florida have done, because that's going to invite the infection to just go on that, spiral out of control trajectory, even if we're continuing to get vaccination rates higher. So we need to be slow, careful about reopening. Right now, we're seeing cases sort of flat in Ontario and in Niagara. And so I'd say that, 3 weeks out from step 3, we've kept cases flat, maybe going up a touch, but not really. But definitely cases aren't going down. So we really can't take another step to reopen anymore right now. We need to kind of hold pat with the restrictions we have in place, with the measures we have in place, and keep increasing vaccinations. And once we get vaccinations a bit higher, if we're able to drive those cases down a little bit more and it gives them a downward trajectory, that's a point where we can maybe take some more steps and reopen. I think it's all about, playing that careful game forward. If we rush ahead and reopen, we're going to let cases spiral out of control. But if we keep watching, we keep cases flat, we don't open up when we're keeping cases flat, we're able to continue to keep that going flat forward and hopefully get through the fall and through Christmas, where it won't be completely back to normal, but we'll have, say the level of openness we have in society right now. And that'll mean that people can actually go to a restaurant and people will be able to go out for Christmas shopping and do all of those things and actually gather as families over Christmas time. So, it's all about keeping the vaccinations going up and making sure we're slow, careful, and cautious about reopening.
And a follow-up?
Yeah, with all the focus on, vaccination dropping cases and preventing hospitals from being overwhelmed, I'm just curious, what's the status of just improving our healthcare system so that hospitals can't be overwhelmed?
Yeah, that would require creating more beds in the hospital sector. And I'm not the expert to talk about that. If you talk to Niagara Health, they could probably speak a bit more about the challenges there. But first off, you just need more physical space. You're going to need more ICU beds, more hospital beds. So do we really have the physical infrastructure for that? I'm not sure how much more physical infrastructure there is. You may remember during the second and particularly the third wave, Sunnybrook Hospital, I think Joseph Brent Hospital, even I think the Hamilton General Hospital started to build these field hospitals out in their parking lots. And that's because there wasn't physical space to keep all those patients. And so I think that's going to be a big barrier. You're not going to be over a course of a few weeks be able to just expand your hospitals unless you go to these kind of temporary field hospitals. Second thing then is that you need to have the healthcare providers present to actually work in those hospitals. And we've talked often about there being doctor shortages, there's nursing shortages. Right now, us in public health and for many months have been struggling to hire on the additional staff that we would like to have to be able to be prepped to manage a pandemic. And that's just because there are, long-term care homes, hospitals, us, everybody's trying to look for more healthcare staff and there aren't enough healthcare providers out there. It's a great opportunity where there's a lot of openings for jobs and there's not enough providers. So I don't know we'd be able to get, the human workforce in place to really ramp up our hospital capacity in the near term as well. And then the final thing to remember is that as much as we don't want our hospital sector to be impacted, even if cases go up and our hospital sector is able to absorb it, there is an impact on society as a whole. Lots of people are going to have loved ones who are going to be hospitalized, which is going to be difficult on them. We're going to have workplaces where employees are sick or hospitalized and not able to work, and that's going to affect the economic productivity. When we look around the world and we're dealing with COVID-19, we actually see that countries that are more aggressive about controlling COVID-19 actually were the ones that ended up with economic growth. Places like New Zealand, Australia, China which had really intense lockdowns, drove cases to zero, completely closed their borders up, they were actually able to have their economies really revert back to, growing. Whereas the rest of us who struggled to keep cases under control, kept having to go to different economic restrictions, had lots of people who are sick, worried about going back to work, we've been the ones who've had the lower economic growth over the last year and a half. If we look at the food service industry, both in the US and Canada, my understanding is the service industry is really struggling to hire people right now because lots of people don't want to go back to work, in part because they see risk of them returning to work in these kinds of settings. And so I think we also want to keep COVID-19 under control so we don't see that impact of people being sick in society. And so people feel the confidence that they can go back to work as well. So I don't see ramping up our hospital capacity as being a near-term solution, and I'm not sure it actually gets us fully out of the challenge of the pandemic either.
Thank you. That's awesome.
Thanks. And last, we have Penny. You should be able to unmute now.
Yes, thank you very much.
Sorry, Penny, I think you muted yourself again.
Am I unmuted?
Yeah, you're back.
I'm going to sound a little pushy here. You talked about the busy community spaces where you might be planning pop-ups, and you explained that you're not ready to schedule them yet, that it takes a bit of coordination. I'm wondering if you could just possibly give us some examples of what you're thinking, like Costco parking lots or malls or community centers. Well, community centers you already have. What kinds of spaces are you contemplating?
Yeah, so, I think additional community centers would be one of those. So we've been in certain community centers, but there might be others that are going to better cater to a population that is farther from the current site. So that's one we'd be looking at. Then we're looking at very much sort of the public kind of places where people would be gathering. So, shopping malls could be one example. We're mindful that lots of shopping malls have pharmacies in them, which can already deliver vaccinations. But maybe there's areas where they don't have a pharmacy already in place that is doing vaccination. That might be a great time for us to hold clinics. We're thinking about schools as well. We're trying to target young people. So could we run clinics in maybe schools and before school gets back into session? And then invite that school community and maybe the feeder schools to those schools to be another place where people could come out. And that gets us to another geographic location where maybe we haven't quite been at, and that's another place where people could maybe have a bit easier access to vaccination. So those are a few examples we're thinking of.
Okay, thank you. That's all my questions.
Okay, so it looks like we're almost at the 2 o'clock mark, so not much time for second questions. So if you could just email Carrie or I with any further questions that you have, that would probably be great. And yeah, thank you all for coming.